talk I will be speaking on the aspiring for ambitious goals, the transitioning of your clinic to an institutional practice. So these are the bricks where you plan, you evaluate, you improve, you measure, and you execute. And these components are very, very essential for your transition from a small scale to a larger scale. So this is a treatise of my 12 years from a clinic to an institute. And it took me 12 years of hard work, and I have not gone to so many conferences, meetings, and I have worked for 12 long years to convert from the small practice to this level. So private practice or a clinic, here the regulations are very less. You can have a small chamber, you can have a rented chamber, you can have small physical space, and you can start with one room. But in an institutional practice, the regulations are increased, and you need more physical space. You have a dedicated team of, you need a dedicated team of admin, and you need to have an organizational structure so that the team, everything runs smoothly. So these are certain registrations which I had to get approval, like registration under Clinical Establishment Act, Biomedical Waste Management, transplantation registration is very important because I'm a cornea surgeon, so I need a transplantation registration of my hospital, otherwise you can't do a transplantation. You need to have an NOC, no objection certificate from the fire. You need to have a drug bulk license. You need to have a drug retail license. And these are some of the licenses which I have showed, and much more than that. So these are certain things you need to know, because as a practitioner, we know only about ophthalmology. We don't know about these things. So these things are also important for your learning, so that when you want to scale up to the next level, these things will come in your way. And also narcotic license. And this is something organizational structure need to be there in your hospital, so that every person is given those jobs, so those jobs can be given, they have to do those jobs independently, so that your headache will come down. You can't handle all the things. You need individual people, different types of people, like for the community service, for the administration service, for the financial service, everything, so that everything will not come to your head and it will be very difficult for you to handle things. So the transition requires three important things: time, place, and person. So time, what matters is the most important is time. Time flies away. So if you want to transition, it's better to be sooner. The sooner, the better. So now you can see, like, you have so many corporate giants, so many hospitals in your vicinity. So you are in among the crowd, and you want to come out of that crowd, you have to stand apart. And that requires time, and that requires some form of knowledge regarding it. And why the time is required? You need to prepare. You need to grow. You need, as surgeons, we are like a students, like small children. When we give an exam, we may fail. And how to overcome that failure and how to lead. So what right now the situation is, the Tier 1 cities, the things have become so impossible. So it is possible that you have to go a little bit outskirts. You have to go to the Tier 2, 3, and 4 cities. That is more easier for you to start your practice and grow. Why the Tier 1 cities? Because it has a saturated healthcare system, very expensive infra, a demanding clientele, and the scope of growth is less because the physical space requirements, you may not have it. But in Tier 2, 3, 4, it's an unexplored terrain. You can go for the needy and obliged patients, because those patients will be more obliged compared to the Tier 1 cities, and there is phenomenal scope of growth. So these are some advantages where there is a recognition, where there is a linear growth pattern, and you can do also community work. But the transition requires the skill and the academics. That's very, very important. So Dr. Anurag has already mentioned how a cataract surgery is very, very important. But during this course, like for example, I'm a cornea surgeon. And ophthalmology is constantly changing. There is advancing. What you had done in your PG time or in your fellowship time, things have changed over the course. And you need to learn again those things. For example, when I was a cornea surgeon during my fellowship period, so I had only knowledge about a full thickness penetrating keratoplasty. I had no idea about lamellar surgeries. But now you know that PK or penetrating keratoplasty has become obsolete. So now you have to go for lamellar keratoplasty, like deep anterior lamellar, like deep anterior lamellar keratoplasty or a DSEK, depending upon the pathology where the cornea lies, in the pathology of the cornea. For example, if there is a posterior part of the cornea pathology in the endothelial pathology, you have to go for endothelial keratoplasty, and if there is a pathology in the stroma. So during this process, like DSEK also, it has evolution. Earlier, you used to do a thick DSEK, but now it has to be ultra-thin DSEK and DMEK. So during these new surgeries, when you learn new surgeries, you have surprises. You have failures. For example, when there is an endothelial keratoplasty, there is a lenticular inversion, lenticular dislocation. So in these patients, you need to counsel these patients. And during this process, you may have medico-legal issues, which will be dealt by Dr. Shishir in the next talk. Hence, again coming back, so you need, what you need is the time. And the time and that enthusiasm, and because time is flying away, so you need time to learn that art. And academics play a very, very critical role for improving the visibility of your practice. It's a critical role in your career and increases your visibility. And how the academics can be divided in two important components. That's one is the conference presentation, which we are doing right now, CMEs, conducting CMEs, public forums, or webinars, all this part and parcel of the academics. But the second most important is the publications. You need to incorporate publications into your private practice, and then only you can scale your practice into institutional level. So you can start when you have no knowledge about publications, you can start with simple case reports. And once you see these cases frequently, you can publish them into like a case series. And then once you have little bit knowledge about the case series, then you can have a simple randomized trials. So for example, like this case, so where I had done a compressive sutures for an acute hydrops in keratoconus. So that time I felt it's okay, but I had documented that case and I thought of writing up that case. But in that process, I got a patent from the PubMed. So it was like a exhilarating experience for me. So some things at that point of time, you may feel that is very small and simple, but it may give you rewards later on. Case series, you are seeing frequently certain cases, document these cases, and then make it into a retrospective study of what you had seen and where are the failures and what are the failures that happened, and then you can publish those case series. And once you have the knowledge, simple cases, you can have a randomized prospective trials also. For example, in this paper which I had published, where I had compared phacoemulsification versus manual small incision cataract surgery in eyes with pseudo-exfoliation, which you see commonly in your practice in grade 2 and grade 3. And I could compare the visual outcome. So this can help you in publishing the higher level studies also. So to conclude, this is a small video. How to aspire for ambitious goal. Your transition requires an expansion of physical space, hire more healthcare professionals, EMRs, expand your services, branding and marketing. You need to improve your visibility, finances, establish a budget secure, community engagement, and finally, the training and development. So thank you for the kind attention.